And we're live.
All right. Well, good evening, everyone, and thank you for joining us tonight on our vaccine panel regarding COVID-19 vaccines and children. My name is Eve Kahama. I'm the Drug Strategy Coordinator in Six Nations Health Services, and I will be your moderator for this evening. Before I begin, I will have Rod Miller, who is our cultural advisor for the traditional medicine program, to open for us. Rod?
Okay, thanks, Eve. and Nigan go down. So town CEO Sky Point go awado. Nigan, you get to and wait for canto, so way these also while we no honok. And then they always thought ni scan or do not and you. And they didn't and way hick, he shot Scott and Dwyer and what ni go ha. Scott and what at no and you, they took any of talk and what ni go ha. And on that, Jaguari, that would when I sa Wednesday. Ne gad yon gwen si dog in drakwe, dwano hat did one home quat. He gwego go to a hat cut, ni saho, ni scano, I do not the new hawk, to ho, joke when jay saho, how one's other do. And then always saw ni yo ya, sat ni so go ho. And 89, what do you know, ni de it no hanyo, sa Wednesday, dwano hat, did one home quat, neguto sat ni a hat, ni to gan ni yok talk and what ni go hat. And on that Jaguari, Nedwood Naya, ne, Honda, yo. Ne touch snake sa na Hawaiian and he. Hanady ne, and what do I know ni, deitino hanyo, Honda yo, need to gan yok talk and what go ha. And on that Jaguari, Nedwood Vanaya, ne, gaining hano, had you yak yono. Ne gad yok yankido, ne scan or one of the yo. Ne gan ne, Guego Gray White go, ne, Gani quat gay, ne hoodie the guiso. Hanady ne, and what do I know ni. Deitino hanyo, gainy hano, had young yak yono, need to get any of talk and what go ha. And on that Jaguari, Nebunaya, ne, so go on, as can you day, ne, those high wine to what, sa, now sang way a hank, o hand, o hot winter the nongi. Hanady ne, in what do I know ni, deitino hanyo, the said one no hanyo, ne, so go on, as can you day, need to get any of talk and what go ha. And on the Jaguari Nedwoodunaya, Honhage, Donkey de Hanagris, way diso. Negane, Otsanonia, Nitson, Tosato, Ne Scano, I do not know. Negane, had initiate, had this on the gay, Goto, ne, Jokwahages, ne Hodinidosha. And ne, and what way no ni, the said one no hanyo, Donkey de Hanagris, way diso, ne to gan Neopto, or Guanigo heart. And on it, Nagat Queenie, Ige, a guy get the Nohanyo. And on young with Nisa, Nene, Gengokwego, Nene, Nene, Oikoge, Nene, vaccines, Donato. So I just did a short opening, a short Thanksgiving address, just to bring everybody's minds together, so everyone's thinking well. And I just said we just mentioned that we're gonna have a short meeting about these vaccines. So yeah.
Thank you so much, Rod, for that opening. So tonight we do have 4 very special guest speakers today who are ready to answer any of the questions that you may have regarding COVID-19 vaccines and children. And I do want to reiterate that the vaccines, especially with school-aged kids, are not mandatory, but they are voluntary. We are just here to provide you with information so that you can make the most informed and best informed decision regarding you and your child. So we have Amber, who is a registered practical nurse and has worked with the Six Nations community for approximately 9 years. She is currently a Jordan's Principal Navigator and assisting children and youth with access to education, social, and health services. She's also worked as a registered practical nurse at Iroquois Lodge and as a case manager with complex needs and as a nurse educator for the Six Nations schools. We also have Carrie Lee, who is an elementary school teacher at Jameson and a mother of 3. We next have David, who's a community health nurse at Oswego Public Health, who's currently doing a double role of COVID-19 vaccine clinics, and as well as conducting contact tracing. And last but not least, we have Dr. Catherine Smart, who is a pediatrician all the way up in the Yukon, and as well president of the Canadian Medical Association. So throughout this presentation, let us know if you have any questions regarding the children's vaccines. Just pop it into the chat, and we will do our best to answer them during the open question and answer period. So we will start off with some general vaccine questions. So David, I wanted to lend this question out to you. So how do the vaccines work and how many doses are required?
So as of right now, 2 doses are required for the youth. And basically how it works is just the messenger, the mRNA is telling the bodies to develop antibodies to help fight COVID in case you contact COVID.
All right, thank you. And what ingredients are in the vaccine, Amber?
So some of the ingredients you might find in the vaccine are the mRNA, which just tells the body to make the COVID-19 spike protein. And this is just, the spike protein is just a small part of the virus, but it allows the vaccine to enter our body, and it's harmless. So it also includes a fat molecule that carries the mRNA into our body, and it includes salt, which keeps the pH and the acidity of our vaccine stable. It protects the fat molecule and helps the body absorb the solution. You'll find sugars in the COVID-19 vaccination. So these keep the vaccine components stable and safe while it's being stored in our body. And then just saline solution, which makes sure the vaccine salt content is the same as the salt content in our blood. Something to know about the vaccination is that if you have an allergy to any of the ingredients, that it's best to consult with a doctor or healthcare professional, just to make sure that it's safe for you to take.
Thank you, Amber. And while we're on that topic of that, who can and who can't get the vaccine?
So I'll start with who can. So children who have allergies to food, latex, medications, children and youth who have allergies, not allergies, but eczema, can take the vaccine, as well as some children who are immunocompromised. However, those who cannot take the vaccination are those who may have a severe allergic reaction to, say, their first dose of the COVID vaccination, who may have an allergic reaction to, or who are allergic to polyethylene glycol, who currently have COVID-19 or are symptomatic of the infection, or if you've had any other vaccinations within the last 14 days.
All right. Thank you, Amber. And David, what are some of the side effects of the vaccine?
So some of the side effects can be broken down into very common or common. Some very common are just pain, swelling, redness around the site, fatigue, and headache. And some of the more common, and some common are chills, fever, and rare cases, diarrhea. So basically, we just got to monitor for signs and symptoms. And if you have pain at the site, a little ice pack will help, along with some Tylenol. Just watch how much you take. And also, if it gets a little bit, if you have allergic reaction, don't hesitate to call 911 which interrupts your respiratory rate and hives and allergic reaction signs.
Excellent, thank you. And what about the risk of myocarditis? Is that a side effect as well that could happen with kids?
No, it's very rare. It's in the small amount. So basically, it's just you're having fluttering or rapid heartbeat with chest pain and a little bit shortness of breath. It's pretty mild, and it can happen within a couple of days after getting your vaccine shot. The best way to treat it is by rest and just rest. But if it's more severe, you will need anti-inflammatories, which can help subside the pain within a few days. And then if you have lung or heart disease, it's best to go contact your medical professional right away, because that's what will make those signs and symptoms a lot worse.
All right. Well, thank you so much. And I did want to take some time to address some of the common myths that we've been seeing. So especially when it comes to kids and vaccines, a lot of guardians have a concern of how does the vaccine affect puberty, or how will it affect my child's fertility? And I wanted to direct this question to Dr. Catherine Smart. Are you able to answer that for us?
For sure. Thanks for the question. Really important question. And it's something I think a lot of folks have been wondering about. So we have no evidence that this vaccine has any impact on children or youth or even adults in terms of fertility or puberty. And, how do we know that? People may wonder. A few reasons. One is we know a lot about vaccines and vaccine science because we've been using vaccines for a long, long time. And even though this is a newer way of giving a vaccine with this mRNA, the technology used in this vaccine has been around for about 20 years. So there's actually quite a lot of knowledge behind it. We've never seen any impact on puberty or fertility from any other vaccination, and we haven't seen that with this vaccine either. So far, our experience tells us doesn't seem to be a problem. And when we look at the science of how immunization or vaccinations work, we don't see any reason why this would be an issue either. So I think we can feel very confident immunizing our children with respect to normal puberty and normal fertility in the future.
All right, that's really great. And you talked about how the mRNA vaccines have been around for a while. Well, a lot of us might think they were made really fast. So how do we even know the vaccines are safe? Can you go into more detail?
Yeah, it's another great question. So the technology, the mRNA itself as a platform for vaccination has been studied for about 20 years. So in a lot of times what we say right now is, in a way we were sort of fortunate because it was being developed already and the technology was there. And then when this happened, it was able to be developed quite quickly into a vaccine. I think a few things, one, what we had is scientists from around the world all collectively putting their energy into this vaccine at the same time, because of course it's impacting everyone around the world. So that really allowed things to happen on a faster timeline than what might be typical when we're trying to develop new things. The other thing I think that's quite different right now than where we even were just over a year ago is millions and millions of people have received these vaccines. And so we know a lot more about the safety. In terms of children specifically, ages 5 to 11, we're also lucky in Canada because they started immunizing this age group of children in the United States about 4 to 6 weeks before we did. So we now have a lot more data on this age group as well. There's been almost 9 million doses given to kids 5 to 11 in the US with an excellent safety record, both of very few what we call adverse events, meaning side effects from the vaccine have been very, very rare. And they've mostly been the normal things we see with other childhood vaccines, fever, sore arm, bit of tiredness. And as you heard from David, myocarditis, extremely rare, only 12 children in almost 9 million doses had that side effect, and all of them it was mild. So I think we can be really quite reassured about the safety. And then of course the other question is, well, does it do anything? Is it needed? And what we're seeing is children that have had 2 doses of the vaccine are much less likely to end up in hospital or severely ill from COVID. So it's both safe and effective.
Excellent. And that leads to my next question. Well, a lot of us think or know that COVID-19 is mild in kids. So why should our children get the vaccine? Why should they get vaccinated?
Yeah, it's another, I think, great question. And I can also tell you, I am a mom myself. I have one son who's 11. So he's had his first dose of the vaccine. He's about to get his second dose. And I have a daughter who's 13 who's had both of her doses because she's in that slightly older group. So I, sort of in my own just life as a mom, weighing those same decisions. And I sort of think of it like this, you know, we are fortunate that COVID in general in children is a mild illness. So thank goodness for that, because of course, all of us are worried about our kids and wanting them to be safe. But for some children, it's not a mild illness. And certainly with Omicron and just so many people getting infected with it being so contagious, we have seen a real increase of children needing the hospital because of COVID. And both kids needing to go to emergency departments because they're just quite ill, and others needing to be hospitalized, and some children ending up in ICU, and some children even dying. Now, fortunately, that's very rare, but it does happen. And I think what's always really tough is you never know who it's going to happen to. So much of what we do in pediatrics is trying to prevent bad outcomes through interventions that are safe. So I sort of think of it like wearing your helmet when you're riding your bike or a seatbelt when you're in a vehicle. You know, we do those things because we know that if we were to fall down or get in a car accident, we're going to have that extra protection, even though that might never happen. And vaccination is a lot like that. You know, all the other diseases we vaccinate our children for routinely, they're very similar. You know, in the vast majority of kids, if they got those infections, they would have a mild illness, but some children get very sick. And that's why we've targeted them for vaccination. And COVID is very much like that. You know, yes, thankfully, most kids will be fine, but some won't. And we can prevent those bad outcomes through the vaccine. And we also know that the vaccine is safe and effective. So I think the most important reason for children to be vaccinated is for their own safety. The second part of it, which I think is important as well, is it also does provide additional protection for their family and loved ones and community. And that's not the primary reason to be vaccinated. You know, there needs to be a benefit for the child directly, but it does also provide those layers of protection for parents, guardians, caregivers, loved ones, elders, or just the community in general. And that's another sort of benefit, as it allows people to gather and be together with that extra safety.
All right, thanks. That's great. And one of the other more common questions we have as well with Omicron, seems like everybody has already gotten COVID. So what's the point in getting vaccinated, or do I even need to get vaccinated if I've had COVID?
Yeah, important question. So what we know is, you know, for sure when you've had an infection, and whether it's COVID or another virus, your body does, of course, make natural immunity to that infection, but that immunity doesn't last forever and ever. And that's why even with many other respiratory type viruses, we can see children get infected with the same one more than once, because they'll have immunity often for weeks to months afterwards, but not necessarily, you know, 6, 7, 8 months later. And that's what we're seeing with COVID as well. You absolutely have some immunity. So for the next few weeks or months right after the infection, you're probably less likely to be reinfected, but people are being reinfected a second or third time. However, if you have had the infection and then you also get vaccinated, the chance of that happening is much less. So I think it still provides additional benefit, longer term protection, and it just sort of gives your immune system more to work with. So if you get exposed to COVID down the road, there's more likelihood those immune cells are going to go deep in their memory and be able to make antibodies to protect you from getting really ill.
All right, well, thanks. That's great and thank you for helping conquer some of the most common myths that we have. And I did want to redirect us and go into how can we get our children ready to get vaccinated? So how can guardians prepare their children to get vaccinated? And I'll let Carrie Lee lead with this one. What are some strategies that you have?
Eve. Yes. So I'm a mother myself. Like Eve had said, I have 3 children. And so first and foremost is making sure that you and your partner are on the same page. You have that conversation with your partner. That's very important. And then it's very important to note that with your child, when you're going to discuss it, making sure that you create a safe space for them and showing the importance of the conversation. So if a TV's on, maybe turn it off. If anything that's disruptive, maybe put that away. That way they know how important it is. And to note to the child that they have a choice. As Haudenosaunee people, we have that gonna that good mind. So we keeping that open mind and not boxing them in or anyone else in that this is the only choice. We're just giving choices and information. So the first step is talking, creating a safe space, turning that TV off. Maybe if they feel safe with a comfort item, that would be good too. And making sure too that anything that they share with you, you validate their feelings, you validate their concerns, and just creating that safe space. And maybe discussing your personal experiences getting the vaccine. So I myself, I am vaccinated, and I've discussed my personal experiences with my daughter. And I like to note that David, he administered my second dose, and I remember asking his name. I said, "Hey, what's your name?" And I was just it was such a positive experience that he just made me laugh. I'm almost 30 years old, and he had me laughing almost the whole time. And so it was very welcoming and very ease. So I appreciate and Yawa and David for making me, my experience very positive. And another thing to note is I know children feel that pressure from sports as Ongohome people and on Six Nations, our youth we're excelling at sports. It's a good way to exert energy and to just all around Ongohome people, we're just ready to roll. We just want to show our skills, and our youth, they may feel hesitant because they're like, oh man, I can't play sports if I'm not vaccinated. Like, it's okay. We have choices, that we're just giving choices, right? So I know that come up with my daughter, the pressure from sports and others, right? But just reminding them that it's okay, you have a choice, don't feel like you're stuck. As parents too, you can do the research, attend meetings such as info sessions like you're here with us right now, so that's great. You can talk to others who have gotten the vaccine or gotten their children vaccinated, talk with them. You can make a pros and cons list. And also to note too, parents or guardians may be experiencing their child wants to get it, but the parents are unsure at this time. So I just want to reiterate that you guys are doing a great job by being here today with us, because this is the first step in getting more informed if your child is wanting to get the vaccine, but you are unsure. Yeah, Eve. Yeah.
Yeah, thank you so much for that answer, Carrie Lee. And I wanted to also shift the same question to Amber. What other techniques are there to prepare your kids to get vaccinated?
So there's lots of techniques that you can use, and working alongside children with complex needs, that kind of came to my mind right away. So some of the things that say an occupational therapist might say is, if you're comfortable letting the healthcare professionals know that your child may have complex health needs and maybe need a little bit of adjustment and special attention when they get to the vaccination clinic. So that could include like decrease the waiting time for when they're getting their vaccination. And also parents can, sing to them, they can read to them. I think Carrie Lee mentioned bringing a comfort item specific to some kids that have complex needs. That might be like noise canceling headphones. Toddler might sit on your lap, or a small child. And then some other things that were recommended were rehearsing it as a family prior to going to the vaccination clinic. So, if you have a play medical kit at home, that'd be perfect. You get an opportunity to play with your child and also kind of play out how the vaccination would go. Another thing you could do is just describe to the child or youth what it's going to feel like. So you could explain that it's going to feel like a little pinch. And there's also some things that you can do in terms of medical, like a topical agent to really relieve pain. Or you could plan a reward for afterwards, and it doesn't have to be something involving finances. I mean, there's snow outside right now, so you could plan to take them tobogganing, or for a winter hike. I think any of those things could help prepare a child or youth when getting the vaccination.
Excellent answers, you two. And going off of that, when children are at the vaccine clinic, David having so much experience there, what types of techniques have you used to help get kids who are afraid of needles ready to get vaccinated when they're actually there?
First and foremost, just get on their level, understand where they're coming from, understand where they're feeling, and just kind of work off of that. You get some high anxiety individuals or some who are ready just to get the shot. So really, as a nurse, you just got to work off of that. Now, if they have high anxiety, there are techniques that we use. A lot of it's just what the parents give us. So a lot of times I get the mom or dad to hold the kid, and even they'll hold them close. And when they wrap their arms around them, they'll expose the arm to give us time to get the shot. But at the same time, we inform the kid that it's going to happen. And we also have to let them know that there's going to be some pain. And I like to use the whole a bee sting compared to a needle. So a bee sting would help more. So, I mean, a bee sting hurts more compared to a needle prick. And that seems to help a lot with some of the kids. And then also the parents will get involved in that good old fashioned bribing. Bribing helps, taking the girls to Claire's, going to Toys R Us, whatever works to help to get your kid get that shot. And then I noticed too with some of the fathers, and especially with the sons, they have more of a hard time trying to connect in terms of when they're at the clinic. And I know some of the sons will sit there and stare at their dad. And I always let them know there's no shame in holding each other's hand or sitting on your dad's lap. There's nothing wrong with that at all. In fact, I encourage it. So it might take a little bit of time. There's been situations where I sat there for 5 to 10 minutes with fathers and sons, and they're just staring at each other. But eventually the son will go over, get in that lap, and then that'll give them the confidence to get that shot. So a lot of times, just be upfront with the child and let them know it's going to happen. And then it might get uncomfortable for some situations, and you parents know which ones you guys are, but that's okay. We're prepared for it, and there's privacy areas too to help with that.
All right, that's perfect. Thank you so much. And I did just want to talk about, I wanted to get to know your understanding. Why do you think, from your own perspective, so thinking about all of the different jobs that you all have, teacher, pediatrician, and nurse educator, and Jordan's principal navigator, why do you think it's important to get the kids vaccinated? So I'll start with Carrie Lee.
Yes. Well, I think it is important because as a teacher, we get the students from different types of families. So there's blended families, there's extended families, and as Onghoe people, there a lot of times our families, we have our aunties and uncles living with us, our grandparents, whoever, and we're living in households where there could be high risks for others, like such as our grandparents or immunization compromised. So as Haudenosaunee people, I feel that we have such tight-knit families that that we have that ganakuyo, that good mind where we just want to keep each other safe. We all just want to be on one path, getting through it together, and we're here with each other no matter what your choice is. So yeah, that's why I think it is important. Thank you.
Excellent. And Amber, why do you think, from your experience, it's important to get the kids vaccinated?
I'd really mimic what Carrie Lee has said in terms of personally why I think it's important to get children vaccinated. However, personally, my family is a big sports family. And so I know Carrie Lee talked about this earlier, but I can really tell the difference between a day that my children don't have sports and a day that they do. Like, they're sleeping better, they're eating better, they're happier. And so to me, that's one of the biggest reasons why I think, my children specifically would benefit from the vaccine, just so that they have access to the sports and recreational activities that, they're interested in. Just to keep them happy in life and to make sure that they're keeping up with their mental wellness as well as their mental health.
So important. Thanks, Amber. And David, why do you think it's important to get the kids vaccinated?
think it's important because it gives them an extra layer of protection with COVID-19. Because when you are vaccinated, can help with your symptom experience, and also reduce your chances of a hospital admission. Because we were finding people who are not vaccinated are having longer symptoms and more severe experiences compared to people who are vaccinated. And that, to me alone, is good enough, because I'd rather go into something knowing that I'm protected and covered, compared to going into something not. And I really don't believe it's worth the risk.
Yeah, thank you so much. You're absolutely right. And Dr. Catherine Smart, why do you think it's important to get vaccinated? I know you did touch on this earlier, but if you had anything additionally to say.
Yeah, I think, for me, I've been a pediatrician now for over 20 years. Many of the years I worked in an emergency department at a children's hospital. So I've cared for very sick kids my whole career. I've also spent time here in the Yukon and in north of Manitoba. So I always find it really heartbreaking when kids don't feel well. Sometimes even a mild or moderate flu-like illness where you have vomiting or dehydration or croup or fever, kids just feel awful, and it's not fun for them or their parents, and it's very stressful. So I feel like if we can avoid that experience for our kids, that's really nice. And of course, the worst case scenario are those rare outcomes where kids are really, really sick and in the hospital or critically ill. And that's really, really scary. So for me, if that can be avoided with something that's a safe alternative, then that would be the choice I would make. And that's why I vaccinated my own kids. They're both healthy children, but I'm like, I don't really want to take the risk because I don't know what's going to happen. And I feel really confident that the vaccine is safe. The other thing that really mattered to me is I live far away from my own parents, but I really wanted my kids to be able to visit their grandparents this summer. And I wanted to make that as safe as possible. So I also felt by having them vaccinated, we could gather as a family and have that time. And I could feel like I was doing what I could to protect them. And I feel that same way about our community. We're also here in the Yukon. It's a very community-minded place where being together and experiencing things together is important. So I also feel like for me, it's part of that love and care I have for the community is doing what I can to help other people be safe. So I think lots of reasons, and I'm just very grateful that this is one of the options that people have to think about.
Well, thank you so much, Dr. Catherine Smart. And I wanted to now open the floor basically for questions. If anybody had any questions about the vaccines at all, feel free to type them in the chat and we could answer them as best as we could. While we are waiting for questions, I do have a couple. So I understand that this next week, we're actually going to have vaccine clinics happening in the schools. Carrie Lee, do you know anything about the vaccine clinics happening in the schools? And I know that there's a bunch of different ones happening from Tuesdays to Fridays. And let us know where the locations are for them.
Yes, yes, there are vaccinations clinics happening right at our schools. So it's important to know all the times are the same from 11:30 to 5:45 to accommodate parents. So the first one is Tuesday, February 5th at Emily C. General School. And then the next day, Wednesday, February 3rd is at JC Hill in the gym. The next day on Thursday, February 4th is at Isle Thomas. And then on Friday, February 5th is at OMSK. And then we are also adding in Gamanilo as well, I believe. Yes.
Yes. And our, so my understanding is that school's still virtual right now, right? And so there's not going to be anything happening.
Yes,
that.
Okay. It's a very, very important to note that these vaccinations won't happen while the students are at school. So these are the dates where kids are still virtual until February 14th, as far as we know. Yeah.
All right. Perfect. Thank you so much for answering that. And we do have one question that came in. I think this would be best directed for David. Do you know if there are pediatric flu shots available on the territory?
Yes, we do. And we just we can do the flu. We've been doing the flu shot over at the vaccine clinic. You just have to inquire when you're there. And if you have any other questions, don't hesitate to direct them towards public health.
All right, and actually to add on to that, can the pediatric population get the flu shots at the same time as the COVID-19 vaccine?
As with adults, it's safe, but with pediatrics, it's best to do 2 weeks in between any other vaccines in regards to the pediatric Pfizer dose.
All right, thank you. As well, so I think this question can be for Carrie Lee. Are the vaccines mandatory for kids? And can the kids still go to school if they don't have them?
That is a good question. So the vaccine is completely voluntary, so that doesn't mean it's mandatory, and kids will not be expected to be vaccinated in order to attend school. So yeah, very important to note, it is not mandatory, and you won't need to show any proof when we may return to in-school learning on possibly February 14th.
All right, thank you so much. And another question that came in, this one's for David. What is the age that teens could possibly get vaccinated without parent consent? Is there an age, or do they need a parent consent unless over 18?
16 seems, maybe this question is better directed towards Dr. Smart.
Sure, I can talk about that. That is a really good question. And I would say there's probably not like a hard and fast answer. It depends a little bit on where you live and sort of how informed consent with youth is looked at where you are. So here in the Yukon, I can speak to, because the law around that's a little bit different everywhere. We here use kind of a concept that often people call a mature minor, which just means if the youth or teenager is able to understand the information, explain to you the risks and benefits, and make an informed decision, then they're able to consent on their own behalf. Of course, I think, as a pediatrician, it's always better for the family or the caregiver or the guardian to agree with the youth and for the family to be moving in the same direction, because certainly we don't want to be disrespecting people's feelings or creating conflict. But sometimes if it does come down to where there really is a difference of opinion and the youth feels strongly that they want medical care, in this case, potentially the vaccine, often they are able to consent on their own if they're mature enough and able to understand the medical decision.
All right, thank you so much. And another question is, so I heard that the doses are different for children versus adults, and why is that? And
do you want me to explain that?
Yes, please.
Yeah, okay, great. So yeah, that's absolutely right. So the dose for adults and people 12 and up is 30 micrograms of mRNA. And for children 12 and up, for 5 to 11, it's 10 micrograms. So the reason for that was children in general generate a bit more of a robust immune response to things than adults do. So how I kind of think of it is, if there's a cold running through your house and you as the adult might have like a little bit of runny nose, but it would be really uncommon to have a fever, and your 2-year-old is got a temperature of 40 degrees with the same infection. That's just because kids' immune systems are a lot more robust, so they generate these bigger immune responses. So because of that, when Pfizer did the study, they sort of hypothesized that they probably didn't need quite the same amount of vaccine to generate the same quality of immune response. And of course, a lot of the side effects we see from vaccination are from our own body reacting and making the antibodies. So if the dose is higher than it needs to be, you can get a lot more side effects, but not necessarily a better immune response. So that's why they studied the lower dose. What they found was with the 10 microgram dose that we're using for 5 to 11, it generated the same quality of antibodies, meaning the immune response was just as good is what we saw with the higher dose in adults and fewer side effects. So it was kind of a win-win. We got a good response. It was equivalent to getting the bigger dose in adults, but we weren't getting any increase in side effects. So that's the reason. The other thing sometimes people wonder is, well, what if my child's almost 12, right? Like they're 11, almost 12, or they're turning 12 next month, or they're 11 and they're a big, tall person. Should I be thinking about the adult dose for them, which is another worry people have. And again, vaccines aren't based on weight or size. They're more based on age. So it's very safe to have your child vaccinated with the lower dose until they turn 12, and then they would get the adult dose. So if you have a child that might be straddling that age group, and right now they're 11, but 8 weeks from now when they're due for their second dose, they're 12, it would be totally fine for them to get the 10 microgram dose now and then the 30 microgram dose when they're old enough, and they would have a good reaction or a good immune response with that.
All right, perfect. Thank you. Yeah, we do get a lot of questions about the big children, if they have the
Yeah.
adult dose or not. And that's
Well, and
good.
it makes sense, right? Because a lot of medication in kids is dosed on their weight. So as parents, I think we're really used to that. And if you have a bigger child, they need more. But because this works differently, it's just literally like giving your immune system a blueprint to react to. It's different than other medications that we're used to. So really good question, but not to worry about it. This dose works really well. And even if you have a bigger child, you'll be fine.
All right, thank you. And we have another question that came in on, what are your thoughts on a 7-year-old getting the shots who does not like needles? They would need to be restrained very much. So what would potentially be the trauma of forcing him to get the vaccine? So I could open that floor to anybody if they'd like to answer.
First, we would just understand the reason why the kid has a fear. And also, we wouldn't force the administration of the vaccine right then and there. We would work with the kid and also work with the parent, because the parent knows who knows their child well, more as well, the provider or the parent. The parent does. So dependent on the situation, the parents may have to hold your child, and there'd be certain cues that we would see in terms of like a kid looking away, and then there's a good 3-second window where the arms exposed and they're holding the parent, we can get it in. But if they're just fighting way too much, we may hold on to another day where the parent and the child can go back home and do some more scenarios and more talking and some exposure therapy going on. So it doesn't have to happen then and there. We're not going to force it. But we also understand there's certain situations where that might be the case. And nothing's wrong with coming back another day.
That's true. Thank you so much for that question, David. Or sorry, the answer, David. And what about booster shots? And I guess I'll direct this question to David. How old can you be to get a booster shot currently at our clinics?
16 plus.
Okay.
16 plus. And then with your with your second shot, 3 months away from your second shot. But that's for immunocompromised. Immunocompromised, they would like it to get it in you a little bit sooner with that 3 month. But if you're healthy, the 2 months and then the 6 month is optimal range. But you can get your booster within 3 months after your second shot, and depending if you're 16 plus, and then if you're eligible.
All right. Excellent. Thank you, David. And do we have any more questions coming in, Katie? And if not, I will come to the closing questions. So if there's any questions that do come up while we're still doing the closing questions, we could address them by any means. And this is again a question for all of you. And I got this question actually from one of the vaccine webinars that I went to last week, and I believe that Dr. Smart was in that one. And I really like this question, and they stated, what is one of your pandemic coping strategies that families can implement in their lives? So throughout this, it's been pretty hard. I can't believe it's almost 2 years since the start. It's been more than a year since they first identified COVID-19 in Canada. Sorry, more than 2 years since it's been identified in Canada. And what have some of the pandemic coping strategies been besides, the sourdough baking and all those TikTok trends? So I'll start with Carrie Lee. What are some of the things that you've done that has brought joy to your family?
Awesome. That is a great question. So what me and my family have done is for the longest time, our lives have been so busy, but because of the pandemic, there's also some positives out of it, right? It's forcing us to slow down and to get more connected and to just get down to our children's level. So I know my children inside and out. I know their cues and everything. So I'm just so thankful that a positive outcome come to this is that we're just so close as a family. And as a family, we're learning more Gayakono, more Kiuga every day. Like my goal with my children is teaching them a new Kiuga word, whether it be a simple command or an object. I try to make it fun for them, learning our culture and our language. That way, we're all learning together. So I find both me and my family are having a really awesome time learning our culture and our language. And that's really benefited us a lot.
Thank you so much, Carrie Lee. And off to Amber. What are some of the coping strategies that you've done?
I'm going to mimic Carrie Lee again and just talk about the family connection, because I think this was huge with my family throughout the pandemic. You know, there's 6 of us, so we have a busy household, and I feel like, you know, during the pandemic, there was an opportunity for us to get that one-on-one time with each other too, especially with 4 children. There's some conflict, but I found that you know, each day or even throughout the day that they would all mingle with each other, even though there's like a 20-year difference between the oldest and youngest. So it was kind of interesting to see that way. But some of the things that we did and continue to do are like family game nights where we'll play, you know, trivia pursuit, or I forget what the game's called, but like you draw and you have to guess what that drawing is. In the summertime or in the nicer weather, we would go and play like outdoor games, whether it was horseshoes or bocce ball. We just spent a lot more time together, and like Carrie Lee said, like we connected in a different way. We slowed down, we took the time to communicate. And it's been nice to have that, like, you know, we're not busy with hockey all the time. We're not busy with lacrosse all the time. And it was just, for the moment, just nice to sit with the family and talk with them.
Thank you so much, Amber. Oops, sorry. What are some of the pandemic coping strategies that you've had during this pandemic?
Are you you cut out there for me. Were you asking me, or is it David's turn?
David, sorry.
Okay, perfect.
So me and my daughters, we just basically just having game night, having safe, also create what I did for them, I create safe places within the household for them where they can go have their own alone time, because kids need structure and interaction, but they also need their own time and their own space, especially when you're confined with your own parents 24/7. And having their safe spaces, like in their room, or we have they have their play basement where everything's down there, and they go down there and they know they can be down there and safe and alone. And also too, we've utilized the programs through health services that they've offered through porch drop off and their online program with their cooking classes. Those seem to help out a lot, especially the craft making. Actually, we all get in there, do a lot of crafts. They had a good one with during autumn season with some kind of wheel with the feather with the leaves all falling down. I forget how it was, how we did it, but they have some really neat crafts that they send to us.
Perfect. Thank you so much, David. And lastly, Dr. Smart, how have you coped with the pandemic?
Well, I admit that I did get on the sourdough bandwagon early in the pandemic, so I have become a sourdough baker. With my 2 kids, I think what we've much like what everyone else has said, sort of try to enjoy the family time. We often in the evening will watch 1 or 2 shows together. We got very into Modern Family, so we're into season 12 of that now, but that's been sort of fun, 40, 60 minutes together, cuddled up on the couch. And then the other thing we try to do is get outside when we can. We have a dog and we try to take them out for walks. And on the weekends, when we have a bit more time, we often go as a family. And that's been something that's been enjoyable as well.
All right, perfect. Thank you all so much for your answers. And if there's no questions, no more additional questions, this will bring about the close to our COVID-19 vaccine education session. And what I will then do is, Rod, if you're still here, if you'd like to send us off in a closing prayer, and then we can end today's vaccine session.
Okay. Yeah, excellent. Yeah. and dan again, go dance what town CEOs. That's what town. It's what town CEOs guy went go sawado. And when I had way we can't so way the so we no hanyo. And then always thought this kind of one up than you. And it named where hickey hill Scott and why and what go ha. Scott did what I told you, they took any joke talk now what go ha. And on it took what in it would na Wednesday. Again. Yung Wesi Dugandra, when no hot did one hunk. Hey, go to a hot cut, ni san ho, ni scano, I do not in your heart to ho, joke when Jason ho, wins other do. And ne always, ni yug yo, yes, and is a goy ho. And ne, and what do I know, ni, the jet no hanyo. O Wednesday, one no hot, did one hunk, ne go to set ni hot, ni to gani yok talk and what ni go hot. And on to Guari, Nedwodunaya, ne Honda yo, ne touch ne gaze, na Hawaiian and he. And ne, and what do you know, ne deity no hanyo, Honda yo, ne to Gani yok talk and Guani go ha. And on to Guari, Nedwodunaya, ne Gani Hano, had young Yakiono, ne Gandio Yakido, ne Scano, do nothing yo. And ne, and what do you know, ne deity no hanyo. Gani Hano had real Yakiono, ni to Gani of talk and one go up. And on Nacho Guadi, Nedunaya, so to go on, as can you day you. Nay, those are high wine what now Sangoya Hank or Hando, how went to the Nongi. And 89, what do you know, need a sort of nothing yo. So to go on, as can you day you, need to Gani of talk and one go up. And on Jaguari, Nedunaya, how hoggy, go hide Hanagri, so go so. Negane, Otsano, ne song to Sato, ne scano, I do not know. Negane had the initial gay, had the Sunday go to your quacky gaze, did you? Who the need outstruck. And 89, and what do you know, ni, that said, no, no, go hide her grace away this song, ne to Gani of talk and go on, go up. And Anito, Negat Queenie, Ige, a guy got duck, the no. And on a haka, hey, ne, the skaka song go, ne, on one, go hustle. And ne go to ne yeti when ne gani hano had yo yakiono ne guego scano hosandwayo sa hojo got scuranyo and again yo talk suniko hegaguego danito. So I just did the opening and closing in Kyrgyz language. I just thought I'd add that since we have a visitor from the Yukon, and it's in the Kyrgyz language, and I think Carrie's studying Kyrgyz language, and I'm also studying Kyrgyz language, so. It was good to hear everybody's thoughts tonight, and Nyawa for inviting me to do the opening and close and to listen in. I really enjoyed it. So, Donito, that's all.
Yeah, thank you so much, Rod, for coming and opening and closing. And with everybody, thank you so much for attending our COVID-19 vaccine education webinar. And we wish you all a good night and a safe week. Thanks.